Timothy Colin Cornelius Rutherford, PhD, University of Guyana. In the context of our discussion and Guyana's Health Vision 2020, there appears to be an advancement towards the well-being of all Guyanese as well as people of the region. My question is, based on the discussions that have been held and the need for research and monitoring through the biological and behavioral surveillance survey, it appears that the focal group for today's discussion has been youth and the impact on lipoprotein to transport the enzymes within the enzymatic system. There appears to be a breakdown in that particular system, perhaps from inadequate amounts of protein or maybe for the quality of protein. I suspect that the new dietary guidelines for Guyana, the new food-based dietary guidelines would add some more information to this. However, I would also like to draw the connectives that was made by our last presenter and those for our First Lady, Ms. Sandra Granger, in areas of cardiopulmonary resuscitation, CPR, as well as external defibrillators. What is the situation as it pertains to the multifaceted role to address suicide in Guyana within all of these various areas? Thank you.
Okay, is there anyone of the panel who would like to respond? Yes?
Well, your last question, I think, speaks to probably the whole national suicide prevention plan that Guyana has. But you've made a number of links. So certainly diet is important. Diet is especially important in children, not just for your physical functioning, but your cognitive brain development. So I think, and I'm sure that is already appreciated by the healthcare workers we have in here, the importance of diet and nutrition. For psychologists as well, we know that you can't do an intervention with somebody and their tummy rumbling and they have a headache, etc. So certainly for children it's important. With respect to our role here, so I'll speak to that because you could tell we're not Guyanese, we're your Caribbean brothers and sisters, but we're not Guyanese. But what we are is we are committed, we're interested, and we're willing, and we've started that this week. CAMPA has been working with UG for the past year or more in developing their programs. CAMPA has a whole network of qualified and competent psychologists who are willing to work and help inform where we can to build on the good work that you're already doing. So I'll leave it at that.
If I may just add to that, there's no question that suicide is a very complex phenomenon. And so we have to approach it using a multimodal approach and a multi-team approach. But in terms of looking at the micro level, I just want to point out that while it is important for us to look to the professionals, the psychologists, the social workers, and the mental health nurses and other persons, but each of us has a role to play. If somebody says to you that they are thinking of taking their life, take them seriously, one. Don't just say that, oh, they just want attention. Yes, they want attention. They're asking you to help them. So take them seriously, right? Don't just brush them aside and say, how could you think of such a thing? You're mad? No, that's exactly what you don't do. So each of us has a role to play. We need to take persons seriously. And as I was alluding to in my presentation, we just need to take the time sometimes to just make somebody else feel special. And that's it.
Okay, thank you. Another question in the back? The last question? Yes.
Pleasant evening to you all. Mrs. Stanley from the National Psychiatric Hospital. We spoke on the previous presentation, early intervention in suicide prevention. And I would want to ask the question, how is it possible that one social worker can be attended to thousands of persons for prevention and to aid in the prevention of suicide? Because at the mental health institute, we are faced with complex situation, and presenters, what you have said to us today, it's very useful. We can impart it back. But where do we go from there? Because of the systematic changes that we have to face, and much is not being done, because we've learned from the PAHO that just 1.1% from the budgetary allocation was assigned to mental health. Thank you.
Thank you.
Thank you very much for that excellent point. But I want to echo, and I do say but I want to echo what all the panelists have said. Suicide prevention and intervention starts with me. When we are training our staff, every single person that's working for us, the cook, the receptionist, every single person gets orientation and training on prevention, on intervention. The other thing that, as was just said, we take every statement seriously. We never brush it off, we don't ignore it, and so whoever comes, I understand what you're saying, that some people have different roles, but once we cross that threshold, we're all one team working and fighting together. So I think that's something that needs to be, if it's not already there, inculcated into all of the treatment facilities for that.
There was a lady there. Yeah, can I just go there?
Good afternoon, everyone. Dr. Stewart. I had a comment in reference to your question, and we've been working in Guyana with suicide prevention for some time now. And through the ministry, we have reduced the rates. Granted, our rates are still high, and we're still working on that. And we have been trying to use many interconnecting areas with the limited resources that we have to be able to address this issue. And we've made some strides in addressing this. We have a lot more to go. And that was one of the main reasons that we needed to institute the degree in psychology, so we could provide some extra professionals that we did not have. We had 2 psychologists in Guyana to provide the care and the response that we so need. Social workers, we lack the human resource, and we have identified that. And through University of Guyana, Dr. Paloma have pushed tremendously to be able to have this program. So now, as we continue, we've already seen a reduction in the suicide rates. We have work to do. We have a long way to go. But now we have a program too that we can empower and educate young Guyanese to become psychologists, to be in the field, to add more to this. And each and every one of us also have a responsibility to help our neighbors.
Yes, nice. And finally,
Just in response to your question, yeah, sometimes with this short staff situation, it can feel like you're trying to shelter from the Kaieteur Falls with an umbrella. It feels like a very daunting task. And I will say to you, one, your self-care to prevent your burnout, to keep you from doing the best you could while you can, until you could do better. We had a situation on the wards where one of our clinical psychology trainees was doing an intervention with some patients, and then it's 2 young people. They were teenagers, and they started to quarrel. Debate turned to quarrel, and then they started to get a little aggressive and a little. It was getting a little out of hand. So one of the nurses overheard, and she came and she told them, "Go back to your beds, go straight, finish this and go straight." One of the girls refused. And what happened is it escalated, and they ended up having to manually restrain her and drag her on the floor back to her bed, and then manually restrain her again. So my trainee, it was the first time she ever saw anything like that. She was very disturbed. She came out, she called me on the phone. She's upset how they could do something like that, etc. And so I waited for her to tell her. I said, "Would you feel comfortable going to the head nurse, Nurse Thomas, and expressing your concerns and asking her about it?" Because I know what I could have told her, but I wanted her to cultivate that relationship. And in the end, she got the story. The nurses were severely short-staffed. The nurses we have not been trained as psychiatric mental health nurses, so they're doing the best they can until they could do better. And also, it's not a secure ward. so that there is no other support for them. So if a patient kicks off, they also have their own safety to think about. So when she got that context, she's like, oh, okay, I understand. Because it's only when we can do better, we get the opportunity to do better. But in the meantime, we have to make sure that the services we're delivering, they're ethical, they're humane, they're in the best interests of the patients and the community and our people. And we have to make sure our own headspace is in the right place, that we don't, same thing for the teacher, in the classroom, yeah? So it's a balance of both.